When you see remote healthcare administration jobs, you might be thinking, well, low pay, data entry, maybe even stepping backward. Well, there's six-figure jobs. So I'm going to be doing a countdown to the number one top paying job in remote healthcare administration, starting right now. All right, we're going to begin with number 10, medical chart auditor. Now, for this job, you're going to be checking patient charts and documentation for things like accuracy and compliance. This is remote work, so you'll need to be able to work independently. Now, basically, this job is about making sure that everything is by the book. The average pay is going to range from $63,000 to $91,000 a year. Yes, it is the lowest pay on the list, but honestly, it is a solid entryway. Now, for this remote healthcare job, you're going to need coding certifications like RHIA, CCS, or CPC. So this is perfect if you're an experienced medical coder who just wants to get out of the office. Here's the deal. It's tedious screen work. So if you get kind of stir crazy just staring at documentation all day, then you're going to get burned out really fast. On the other hand, if you're a detail hound, well, you'll like that focused autonomy that comes with this job. You can apply for jobs like this in Indeed and AHIMA job boards. Number 9 is Accreditation Compliance Coordinator. Now, this role means that you'll be managing the whole process. So you're going to be dealing with all the documentation to meet those picky national standards like Joint Commission. Now, it's all about the process and the proof. Now, the average pay for this job is a very respectable $73,000 to $107,000 a year. So who's a good fit and what do you need? Generally, you're going to need 3 years of experience in compliance or QA. If you love checklists and most likely the most organized person in your family, then this is your zone. Now, here's where the rubber meets the road, though. You'll be needing to constantly update documentation. You'll need to be highly organized and have ninja skills at digital record keeping and working through complex regulations. So this isn't a glamorous job, but it's stable and it's remote. You'll find jobs like this on LinkedIn, hospital career boards, and places like FlexJobs. All right, coming in at number 8 is Healthcare Project Manager. As a Healthcare Project Manager, you'll be leading change. Now, this is going to be about navigating the new tech and the new policies and the new procedures, too. So you'll be coordinating remote teams and managing budgets and keeping all the stakeholders aligned. Basically, you're going to be the person who makes things happen. The average pay is right in that six-figure sweet spot, $84,000 to $155,000 a year with an average of $110,000 a year. Now, there are some hefty requirements for this job. You'll probably need 5 years of project management and have a PMP. This is a good fit for former clinical staff, IT managers, or business leaders who actually know how to herd cats. So now for the reality check on this, you're going to be juggling competing priorities. You're going to be dealing with constant virtual meetings and do some heavy-duty performance tracking. So it's not easy, but the pay reflects that. You can apply for jobs like this at ZipRecruiter, LinkedIn, and insurance and health tech companies like United Health Group. All right, here we are at number 7, Senior Revenue Cycle Analyst. As the name implies, you're going to be dealing with the financial end of healthcare. So you'll be optimizing the money flow, things like billing and coding and reimbursements, things like that. And you're going to be working remotely with data analytics every day. Now, the average pay for this job is going to be around $95,000 a year, and it can range all the way up to $135,000 a year. You're going to need a finance or health information degree and very strong data skills. This is probably a good fit for former medical billers, finance analysts, or someone who can spot a dollar on a table. Now, here's some other things you need to know. You need to be able to keep a cool head because things move fast. But here's the best part. That's exactly where your years of experience come in. You've already spent decades learning how to handle pressure, and that's your superpower. You can apply online on sites like ZipRecruiter, Glassdoor, major hospital systems like HCA Healthcare. All right, for number 6, we've got Clinical Program Manager. As a Clinical Program Manager, you'll be designing and overseeing clinical and population health programs, and you'll be coordinating providers and payers remotely and analyzing specific health outcomes. So it's like thinking strategically about the impact of certain health programs. Now, the average pay is going to range from $95,000 to $135,000 a year. You'll probably need a bachelor's in nursing or public health. This is a good transition role for experienced nurses, doctors, or therapists who want to trade the bedside for the strategy table. Now, keep in mind that outcomes get scrutinized. You're going to be coordinating across multiple time zones, and your success is going to depend on your digital communication skills and your reporting skills as well. Jobs like this are listed on LinkedIn, United Health, Optum Careers, and ZipRecruiter. All right, here we are at number 5, Healthcare Compliance Manager. Healthcare compliance managers are the policy watchdogs, so they make sure that everything that your organization does follows every last legal and ethical standard. So I'm talking about audits and training and policy, but the upside is that you're going to be doing it all from your home office. Now, this is where the money is, folks. I'm talking $100,000 to $146,000 a year. You're going to need a bachelor's degree and probably at least 5 years of experience. This is for you out there that are former administrators, auditors, or the person who knows HIPAA laws like the back of their hand. Now, here's the truth. This job can be a bit stressful to stay on top of changing regulations. So if you hate reading legal text, then skip this one. But if you love preventing a disaster, well, this is your job. Now, you can find jobs like this on Indeed, Teladoc Health, and LinkedIn. Coming in at number 4 is a Revenue Cycle Management, or RCM, vendor manager. Now, in this job, you're going to be managing the other people, the third-party billing and coding vendors. So you're going to be dealing with contracts and relationships, making sure that their work is compliant and it's accurate. In essence, you're the connection between the organization and the outside teams. Now, the average pay for this job is a solid 6 figures. We're talking $92,000 to $132,000 a year. Most have requirements like 5 years in revenue cycle or vendor management. Now, this is a people and paper job. It's perfect for former operations professionals. Now, here's what really matters. You need to be blunt, fast, and firm with those multi-million-dollar vendors. These jobs need your authority, and honestly, your age is going to be an asset here. You can apply for jobs online in places like ZipRecruiter, LinkedIn, and provider networks like Ascension and Sutter Health. And number 3, we've got Director of Ethics and Compliance. Now, this is definitely executive level stuff here. So you're going to be leading the entire ethics and risk management program for a large organization and overseeing investigation teams remotely. You're the one that sets the tone for how the whole company handles the tough stuff. This is some serious executive money here, $154,000 to $210,000 a year. You'll need 10 plus years in the field and a track record of proven executive leadership. This is for attorneys, former compliance VPs, and division heads. You'll be navigating high-stake incidents and ethical gray areas too, and building consensus with dispersed remote teams is absolutely essential. So you can think of yourself as being like a virtual diplomat. And you can find jobs like this on Indeed, Glassdoor, and major hospital corporate sites. All right, now we're coming down to the wire. Here's number 2, Compliance Officer. As a compliance officer, you'll be developing, implementing, and owning the entire compliance program. Now, this job is at the top of the org chart. Everything that touches compliance, it flows through you. Now, as far as salary, this is where things get really serious, $145,000 to $268,000 a year. Now, most likely going to need 7 plus years in compliance with leadership experience and preferably have an advanced degree. Now, this is for the seasoned professional who comes from a legal or audit background. This is a high accountability position, so when something goes wrong, the buck stops with you. You'll be problem-solving very sensitive issues remotely, sometimes after hours. So this is for leaders who thrive under pressure. You can apply at places like Centene, Humana, and Flex Jobs. All right, here we are at number 1, Regulatory Affairs and Quality Vice President. This is the ultimate executive role in healthcare. You're setting the regulatory and quality strategies for the entire organization. You'll be managing global or regional teams. You're going to be the one who has to think years ahead about what your organization needs to do to succeed. Now, as you can imagine, the pay ceiling is high, like $190,000 to $250,000 a year and beyond. You'll need a master's or Juris Doctor, and most likely you're going to need 10 plus years of leadership and be able to prove a measure of multi-site management success. This is for the former chiefs, VPs, and directors that are ready for a new challenge. As you can imagine, you'll be managing complex legal, PR, and compliance risks across multiple time zones. So the strategic demands of this job never stop. But here's the truth. Your past executive experience is the only thing that matters here. You can find positions like this on Indeed, Fortune 500 health firms, and FlexJob executive categories. If you'd like even more guidance on launching your second act, be sure to check out this next video on in-demand jobs for 50 plus. Just click the link that's here on the screen, and I'll see you in the next one.